Technical Veterinary Learning Channel, honored by Prof.Ahmed Mamdouh El-Sherif, Professor of Epidemiology and Infectious Diseases, the ex-head of Department of Veterinary Medicine, the ex-vice dean of Faculty of Veterinary Medicine, Pennsylvania University, presents today one of the most important infectious diseases of equines and man to all colleagues of scientists, dear veterinarians, and to all students of veterinary medicine all over the world. Equine encephalitis. The second part of this lecture includes clinical signs, diagnosis of the disease, differential diagnosis, supportive treatment, prevention and control. Diagnosis of equine encephalomyelitis diseases. Clinical signs. Clinical signs of equine encephalomyelitis, beginning with mild fever associated with anorexia and depression, with hypersensitivity to light, sound, and touch, and this due to the infection of the virus to the brain. Restlessness, blindness, walking, stuck to wall, and tremors of facial and shoulder muscles, long time taken by stallion for erection of the penis. This all due to affection and inflammation and destruction of the brain cells that infected by the virus. Sleep stand appearance with putting the head at the walls as head tilt, paralysis, front leg crossed, incoordination during walking, unable to swallow, stop defecation and urination, complete paralysis, with death occur within 2 to 7 days from the first sign appears. This is a photo of a horse unable to head standing without support on wire. A photo of classical form of the disease where this horse unable to head standing without support on harness. A photo of a horse unable to head standing without support on the wall of his spine, and this is the classical form of equine encephalomyelitis diseases. A photo of a horse suffering from equine encephalomyelitis showing blindness, trembling writing, sound sensitive, drowsiness, and paralysis by the hind legs. A photo of a horse suffering from equine encephalomyelitis showing muscular and skin twitching, hyperesthesia, propulsive walking. A photo of a horse suffering from equine encephalomyelitis which are unable to stand with crossed legs, so we have to using artificial support for standing. A horse suffering from end lethal stage where it has a complete paralysis, sensitive to light, sensitive to sound, and unable to swallow with very difficult defecation and urination. Laboratory diagnosis of equine encephalomyelitis. Samples collection. From live animals, we collect double pairs of serum with 2 weeks apart. Number 2, blood sample. Number 3, cerebrospinal fluid. From dead animals, we collect portions from the brain. Most accurate is the viral isolation on cell culture to catch the pathogenic risk factor. Serological examinations done by complement fixation test, heme agglutination inhibition test, ELISA, different types, plaque reduction neutralization test. Real-time PCR is the most accurate test for diagnosis of equine encephalomyelitis. Histopathological examination of affected brain from deceased animal to see the necrotic areas of the brain. Eastern equine encephalitis virus diagnosed by colored transmission electron microscope TEM as seen in this photo. Japanese encephalitis is diagnosed by commercially available test detecting Japanese encephalitis virus specific IgM antibodies in the serum and or cerebral fluid, for example by IgM capture ELISA. Japanese encephalomyelitis virus IgM antibodies are usually detectable 3 to 8 days post onset of illness and persist for 30 to 90 days, but longer persistence has been documented. Therefore, positive IgM antibodies occasionally may reflect a past infection or vaccination. Serum collected within 10 days of illness onset may not have detectable IgM, and the test should be repeated on a convalescent sample. In fatal cases, nucleic acid amplification and virus culture of autopsy tissues can be useful. Viral antigen can be shown in tissues by indirect fluorescent antibody staining. Western blot SDS page viral protein were visualized by staining with Comasi blue. Lane 1 showing the molecular weight standards of myosin, galactidase, phosphorylase, bovine serum albumin, and altadose. Lane 2 showing Eastern equine encephalomyelitis virus strain PE6. Lane 3 showing the Western equine encephalomyelitis virus clone Western encephalitis virus 1000. Lane 4 showing the M of Western encephalitis virus 1000 clone. Lane 5 Western encephalitis virus clone Western encephalitis virus 2000. Lane 6 showing M Western encephalitis virus 2000 clone, and lane 7 Western encephalitis virus strain kappa 87. E1 and E2 represent the positions of Western encephalitis virus glycoproteins. C represents capsid proteins. All of this will shown in the next photo. A picture of SADS page of Eastern encephalitis virus and Western encephalitis virus with the different kilopairpase for their proteins. Genome sequencing to identify the source, place, and or new viral mutations. This is a photo of phylogenetic tree of complete genome of 28 Japanese encephalitis virus isolates. The 6 isolates from KPP, Thailand sequenced for this study are highlighted in bold text, and the host species is indicated after the strain names H. human, M. mosquito, P. source of publication. This photo showing unrooted phylogenetic tree of Venezuelan equine encephalitis virus complex and other representative alpha viruses that derived from complete structural polyprotein sequencing using the Nepal joining program implanted in PAUP. Viruses are labeled species according to the International Committee for Taxonomy of Viruses. Numbers indicate post-strap value 4 clades to the right. Differential diagnosis of equine encephalomyelitis. All diseases cause nervous manifestations such as pornoticis, West Nile encephalitis, and rabies has to be differentiated from the sum of latter explained equine encephalomyelitis viruses. Supportive treatment. There is no specific treatment for equine encephalomyelitis, and the treatment is only supportive with assistance given for feeding, breathing, or seizure control as required. Raised intracranial pressure may be managed with mannitol. There is no transmission from person to person, and therefore patient does not need to be isolated. The effectiveness of intravenous immunoglobulin for the management of encephalitis is unclear due to a lack of evidence. Intravenous immunoglobulin for Japanese encephalitis appear to have no benefit. Prevention and control of equine encephalomyelitis diseases. Vaccine for horses. Number 1, formalin inactivated vaccine for Eastern equine encephalomyelitis and Western equine encephalomyelitis. Number 2, attenuated tissue culture vaccine for Venezuelan equine encephalomyelitis. Japanese encephalitis vaccine. There are currently 3 vaccines are available. Marketed in Australia, New Zealand, and India. All current vaccines are based on the genotype 3 virus. Mosquito management through 7 steps: surveillance, source reduction, personal protection, biological control, larvicide, adulticide, and biosafety. Surveillance include dead bear testing, sentinel chicken flock, mosquito collection by test for pathogens and account for species, larval and adult mosquitoes by map habitats and record keeping, then determining nuisance vectors. Source reduction by eliminating larval habitats such as garbage collection, riverside tires, bird baths, containers, rain gutters, unused swimming pools. Making habitats unsustainable for larval development and public education, marsh water management by drain, fish access, and gated. All of these will help in source reduction. Personal protection through reduced time outdoors, especially evening hours, wear long pants and sleeves, use mosquito repellent such as 35% DDT don't use in your animals. Number 4, make sure all window screens are intact. Number 5, use yellow bug light bubbles in outdoor light fixtures. Biological control through utilizes predator, both natural and introduced to eat larvae and pupae, mosquito fish. Other agents has been used but are not readily available, fungus, protozoa and nematodes, and copepods. Larvicides use when source reduction and biological control not feasible. More effective and target specific, less controversial than adulticides, applied to smaller geographical areas. Larvae concentrate in a specific location. This table showing larvicides products such as timifos and methoprene, etc. and etc. Adulticides, when other control measures unsuccessful, least efficient, proper type and time of application helps efficacy, arterial volume foggers, 250 gram per acre and فدان, small droplet contact and kill adults. This table showing the adult side products such as malation and etc. The biosafety includes mosquito avoidance, precautions, bug spray, long sleeves, etc. Wear gloves or double plastic bags to collect dead birds. Wash hands after handling. Manipulate carcasses in biosafety cabinet when possible for necropsy. This lecture recorded by me, Prof. Ahmed Mamdouh El-Sherif, at the 6th of April 2020 during the time of corona pandemic all over the world. The best information for you and me and for all humans, stay home to stay safe. Thanks a lot to those keeping us safe. Please, if you want to follow the most informations about the different infectious diseases of animals, subscribe the channel.